Good morning, doctor. Today I'm going to talk to you a little bit about two topics. I'm going to put them together for you in an interesting way. One is, as a pediatric dentist, which I am, whether you're general pediatric, orthodontist, whatever you are practicing, if you're treating child patients, this will be of interest to you. And the second topic is going to be what's happening with healthcare and insurance and your practice today. So we're going to put this together. First of all, when we were in dental school, let me say this, and you got the same information I did, I'm sure. Prevention was the word of the day. Obviously, as a dentist, you're treating the disease of caries, the finding of decay, but you would like to prevent it wherever you can. So you become the teacher. Now, you didn't go to school to be a teacher, most of you. You went to school to learn how to be a dentist. That's a doctor who treats diseases of the mouth. And of course, because of that, you have an interest in helping the patient and parent to do better with their prevention. So that's great. That's the first topic. And so you spend time, and your staff spends time, teaching children to brush their teeth. I look at Instagram and I see pediatric practices showing how cute the child is in the chair, and they all are. Oh my gosh, don't we have wonderful moments with those precious ones in the chair and mommy beside. It's just wonderful. But we're teaching them to brush their teeth over and over and over again. Well, you're a teacher. And education is a part of our practice. But guess what? You don't go home with that child, which of course you know. You go home with your children. And how hard is it to get them to brush their teeth? And do you brush their teeth every night? Probably so. Do the parents do what you're asking, to brush the child's teeth every night? Probably not, in most cases, not all. So here we have a conundrum, because we're seeing these cute children in chairs. We're enjoying our little patients and the parents and spending time teaching them to brush their teeth. First of all, delegate as much as you can. You're paying someone to do it, so you're still paying for it, but at least you're not doing it. You're mentioning it, but please don't spend a lot of time teaching that. That would be an absurd use of your valuable time. Number two, the insurance companies do not pay for that. And if you're an insurance-based practice, if you have 10%, let alone 85 or 90% insurance patients, you're not getting paid for that. You're not getting paid for what you do that they supposedly pay for. You know that. This is a big problem today. So you need to think about the fact that get your social media going to show that you love the children and parents, because you do, and get your staff to do the things that you're asking to be done at a minimum level, because again, are the parents complying? Question. And be sure you're charging for what you're doing the best you can. Now, on another series of videos, you will see me over and over saying, get out of the insurance game. But that's not the topic of this one. This one is get paid for what you're doing as much as possible. This is what you do for a living. So that's my thought for you today. Children brushing their teeth and getting paid for what you do in your practice. So give it some thought, doctor. I love you.